My name is Dr. Syed Raza. I'm an associate professor of medicine at University of Tennessee, Rheumatology department, as well as I am a staff member at Regional One Health. Rheumatology is a specialized field of medicine which focuses on diagnosis and treatment of diseases of musculoskeletal system and connective tissue. So I will divide the conditions that we treat as rheumatologists into two big categories. One is, of course, autoimmune inflammatory diseases, and then the second conditions are non-autoimmune and non-systemic autoinflammatory diseases. So as an example of autoimmune diseases, we treat rheumatoid arthritis, and then there are related arthritic conditions in that category. We also treat patients who have systemic lupus erythematosus, and there are other connective tissue diseases in that category, including Sjogren's syndrome, systemic sclerosis, myositis, vasculitis, where there is inflammation in the blood vessels in the body. Then there is a non-autoimmune disease category where we deal with conditions like gout, which is a very common arthritis caused by uric acid elevation in the body, and osteoarthritis, which is the most common non-inflammatory arthritis in the world. Then there are soft tissue rheumatic diseases like tendinopathies and nerve entrapment syndromes, back pain, things of that nature. In the last 20 years, there have been significant advances in our understanding of these diseases and the treatments that we can offer to our patients. There are symptomatic treatments for patients who have more of a non-specific soft tissue problems like tendinopathies or nerve entrapment syndromes or back pain. Then the big chunk of our practice, as I mentioned, is autoimmune rheumatic diseases. So we have specialized treatments for that, which could include oral medications, which could include injectables, which are called biologics, and there are infusions, which are also biologic treatments. What we do in rheumatology can really affect the quality of life of the patients that we are treating. Because of these new emerging and new treatments that we can offer, by using appropriate treatments, we can actually not only help with the patient's quality of life, but will make them, we can keep them functional members of the society and reduce the societal cost that comes along with these significant diseases. If you cannot empathize with the patient, you cannot be a good doctor. So when I'm seeing a patient and I'm making a medical decision, I'm thinking, will I do that for my loved one or not? If I think no, then I will not do it for my patient.